Is it this okay with you?
Yes,
Is it okay
yes,
with you? Okay.
yes, doctor.
So, can you briefly tell me about your condition, how you are feeling for last few months?
Yes, doctor. Thank you for asking. Actually, I have this backache for last 4 months, but it is in gradually day by day. So it's reached to the point that I'm unable to attend my work now.
Okay, that must be very difficult time for you. I'm sorry to hear that. And don't worry, I'm here to sort out and I will do my best to guide you well. Okay?
Thank you, doctor. Thank you, doctor.
Okay. And can you tell me one thing that do you have any diagnosed medical condition?
No, no, doctor.
Okay. So going back to your main complaint, I would like to ask some questions. You said this pain is progressive since from the beginning, and now you are suffering very much. So, does it occur any specific time of day?
Yes, doctor, you're right. It's more in the morning when I'm getting up from the sleep.
Okay. And is it in lower back or in upper back? Can you point out?
Yes, doctor, you're right. It's in the lower back.
Okay. And if I ask you to grade it from 1 to 10, how you will grade it about the intensity of pain?
Yes, doctor. It's sometimes, especially at night, it might be a 8 by 10.
8 by 10, that's very severe. Okay.
Yes, doctor.
And does it move to somewhere like your buttocks or legs or anywhere else?
No, doctor.
Okay. And how it gets better? Have you taken anything or you did something for it?
No, doctor. When I'm start walking and start working, it is getting better. And sometimes some painkiller, which doctor had advised me in the past, is also effective for sometimes.
Okay. And you say that when you wake up in the morning, it increases.
Yes,
So
doctor.
do you mean to say that it increases with rest?
Yes, it increases during the rest. You're right.
Okay. And any associated stiffness or any other complaint with this pain?
Uh, like doctor.
Any stiffness? Any stiffness? Any stiffness in back? Like
Yes,
difficulty in moving, in bending, like that.
yes, doctor. There is a stiffness at night and in the morning also. Sometimes it's so stiff that I am unable to move my body, whole body.
Okay, I'm sorry to hear that. And one thing more, is there any other joint involvement other than this lower back?
No, doctor.
Any other? No. Any heel pain or feet pains?
No, doctor.
Okay. And have you noticed any rash on your body anywhere currently or in
No,
past? You have any skin condition?
no, doctor.
Okay. And how about your bowel works? Is it normal or any abnormality with that?
Both of them are fine, doctor.
Both are fine. Okay. Do you feel any weakness or any sensory abnormalities like walking on cotton wool in your lower limbs?
No, no, doctor.
Okay. One thing more, that do you feel anything abnormal sensation when you wipe out after passing a stool in that area?
No, doctor. No.
Okay. Okay. And do you have any associated eye complaints?
No, doctor.
Okay. Any mouth ulcers?
No,
Okay. Any other complaint of racing and pacing of heart anytime?
no,
And any other complaint of breathlessness?
no.
Uh, do you have ever had any chronic cough or fever at nights and night sweats?
Sometime, doctor, yes, I feel that I'm coughing most of the day and it's dry mostly.
Okay. 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 And uh, no night sweats or fever along with
No,
that?
no, no.
Okay. And is there any weight loss associated with these complaints?
No, no.
पापा ने कैमरे में से पकड़
Okay.
लिया उसको
Okay.
जब पापा
And is there
गाड़ी नहीं थी
Kindly mute your mics, please, doctors, please.
Do you think you had any infection of urine before starting this pain?
Any words of doctor?
Urinary complaints like burning or passing a stone in urine, anything like that in urine
No,
before
no,
this
doctor.
pain?
No,
No,
no.
nothing like that. And any complaint of increased thirst, hard stool, or any headache, vertigo?
No, doctor.
Okay. So, is there any swelling along this pain in your back?
Swelling, I didn't feel actually. I
Oh,
cannot see there.
okay, okay, okay. Thank you. And do you have any other complaints like uh, diarrhea and hard stools?
Doctor, you already asked me. I said no, not there.
Okay, okay. Sorry for that. And now, do you have any allergies to drugs or any medicine or food?
No,
Okay. Are you taking any medicine for this condition or for any other condition nowadays?
no, doctor.
Okay. And have you ever been hospitalized for any condition or for this reason?
No.
Okay. And is there any family history of any specific illness in your family?
No, doctor. No specific illness in family.
Okay. And I would like to ask some private question. Is that okay with you?
Yes, doctor, sure.
So are you sexually active?
Yes, doctor.
Okay. And do you have any infection in urine or any other abnormal discharge ever?
No.
Okay. And do you smoke?
Yes, doctor. Yes, I smoke.
Okay. How many cigarettes in a day?
Yes, 10 to 15 cigarettes per day, doctor.
Okay, that's quite heavy smoking. Do you know? I hope you know about the hazards of smoking.
Yes, doctor, I will try to quit it.
Okay, if
Thank
you
you.
allow me, I will refer to you social work so that they can help you in quitting your smoking. Okay, if you
Okay, thank
want
you,
that,
doctor.
then let me know.
Okay.
And what about your? Do you take alcohol?
No, doctor. Occasionally, sometimes during
Okay.
events, otherwise no.
ايوه في الكتاب يلا افتحي دي الريفيجن دي
Okay.
Please
اسمها
mute
شنو؟
your mics, please, doctors. Please, please. It's humble request.
Okay. And other than that, what about your job and what do you do for living?
Doctor, I'm a school teacher and I'm living with my family. I have two kids.
Okay, that's good. And can you tell me that how this illness has impacted your daily
One
life
second.
and your job?
من اول
1 second, doctor.
فصلنا
I was
الربيع
going
والصيف
to
Okay,
مع
okay,
فصلنا الربيع والصيف
just a minute. Doctor, please mute your mics. I'm going to mute all. And Dr. Saja, I will allow you to. Okay. Uh, you can unmute yourself. Hello.
now can you hear me?
Yes.
Hello,
Yes.
can you hear me? Oh, okay.
Yes, doctor. I'm hearing you. Yes, your voice is clear. Please continue.
Okay. I want to know that how this illness has impacted your daily life as well as your job.
Thank you for doctor. Thank you for asking. Really, you are very good doctor. I'm really suffering a lot nowadays. I'm missing my duties, and it's very hard for me sometimes to cope my daily activities at home also. And that's what I'm feeling. I'm sometimes feeling that I'm unable to go to the markets even.
Okay, that must be very difficult for you. And for that, I will, first of all, if you allow me, I will refer you to the social work and they will, let's see how they can help you out in home help, etc. if you allow. right?
Thank you, doctor. Thank you so much. Yes, thank you, doctor.
And for your job purpose, if you allow me, then we will involve the occupational therapist, and let's see that how they will help you. Okay.
Okay, okay.
Okay. And do you drive?
Yes, doctor. I drive.
Okay. For your own purpose, not for any job purpose, right?
No, no, no. I'm going to my
Okay.
job and coming back from the job and taking my family. It's a home
Okay.
car.
Okay. Okay. So, do you have any concerns up till now that you want to clear?
Yes, doctor. I'm really very depressed nowadays. I'm unable to sleep because I'm thinking too much. What's going on with me? Why I'm not getting better despite this some medications?
Okay. So, I appreciate that you want to know about your illness, and that helps us when we know about our disease. Based on the symptoms and the history that you have told me about your illness, most likely, uh, I would say that you are suffering from ankylosing spondylitis, and it is a condition in which there is inflammation of the lining of joint, and that's mainly the joint of lower back and spine, and that's why it is causing you these pain. I hope you understand that.
Yes, doctor. But is it a curable condition, doctor?
For that, first of all, I will reassure you that we will go through a multidisciplinary approach. We will involve the joint specialist, the
Mhm.
physiotherapist, and occupational therapist, as I told you. And then, with the help of all these things, with the physiotherapy and regular exercises and medication, you will get better with the medication, and you will feel much better after the proper medication that we will provide you. Okay. So
Okay.
this is
Thank you.
a treatable condition. We can cover up your symptoms, right?
Okay. Thank you,
Okay.
doctor. And
So,
one more thing, doctor. I
okay.
was very worried about my future. My children will get this disease or not.
So it is a genetic condition, and this is likely that they can have that in their future. But for that, we will go for the early screening program for them, and screening test for them, and then so that we can take action on proper time, and we can decide about their conditions, and this will help to cover up their symptoms and will prevent them from getting worsening of their symptoms and disease. I hope you understand that.
Yes, doctor. Thank you. Thank you so much.
Okay. So now I'm going to examine you. Before that, I will discuss the generalized summary. One thing that I have mixed notes, but you should not be
Doctor,
worried that it will be
two
kept
minutes left.
confidential.
2 minutes left.
Okay. Okay. Now I will examine you,
Okay.
and first of all, I will ask you to examine in this lying position, and then I will ask you to stand if this is possible for you. Okay.
Okay. Okay.
So I'm describing the examination right now, doctor. Okay.
Okay. What do you want to see in the hands, or how you're going to start this
Yes.
examination?
Yes. First of all, from starting from hand, I will look for the nail spitting and any changes in sausage
Nails
finger
are
for the
normal.
psoriatic.
Nails are normal.
Okay, and any sausage-like fingers in your swelling,
No,
inflammation?
no,
No.
no.
Okay, I will check your pulse, and if it's good volume, I will do according to that some tests.
Why
Okay,
you want to?
and I will
Why
write
you want to see the pulse?
to check its volume. If it's high volume because of some aortic condition which is common in this disease, we will look
Okay.
for high volume pulse. Okay.
Okay. Okay.
And I would also like to know the blood pressure.
Okay. Next.
Okay, and uh, along with that, I will look for any skin rashes on the back of your elbows. Is there any skin rash
No rash.
on back of on your neck, on your scalp, or behind the ears, anywhere?
No, no rash at all in the body.
Oh, okay. And I would like to look for any abnormal pulses in your neck as well. Okay.
Uh, Okay. Dr. Mamuna, your time up, but I'm going to give you 2 minutes more and we will discuss later on. Okay. Why I'm giving you, just complete your examination step. Okay.
Okay. After that, I would look for any eye redness, and I will look for the mouth ulcers, and then I will look for the aortic like regurgitation murmur. That's very important. Also, I would like to see the apical fibrosis, and as well as I would like to look for any pulmonary hypertension and T2 and basal crepitation for if there are any signs of heart failures secondary to
Okay.
AR. Okay.
Okay.
And
Okay.
in the abdomen, I would like to look for left iliac fossa tenderness for any rectal involvement. And then
Okay.
after that, in the lower limb, I would like to examine the motor system. And then I
Okay.
will ask the patient to stand and to move the neck from side to side to see any stiffness and the flexion of neck and the lower back. First of all, I will also check the posture from the back and from the side. And
Okay.
in the back, lower back, I will ask for the bending for the patient from side to side and forward bending. And I will look for the tenderness on sacroilius, that is the dimple of Venus bilaterally. And in the end, I will perform the modified Schobert test. Last one thing that I will ask the patient to stand with the wall, and if he can touch the back of his head with the wall to see any stiffness.
What you want to see in the this near why you are asking the patient to stand near the wall? Is there a specific thing?
because because if there is a stiffness, yes, this is a test name I forgot, but this is a specific thing, like the distance between the occiput and wall increases if there is stiffness and the muscles of the spines, ligaments of because of the stiffness of spinal vertebral column, our spine.
Okay. Okay.
Okay.
Is there anything else you want to do?
No, doctor. I have done the
Okay.
modified Schober as well. I have explained
Okay.
that. And
Okay.
saddle anesthesia, I have asked, and in the end, if I get time, I will do that.
Okay. So present your case. You have 1 minute to present your case.
Okay, so 35 years old Mr. John came to us with the complaints of uh, lower backache for last 4 months, which was gradual in onset, and it was severe in intent, moderate to severe in intensity, and mostly it occurs after sleeping and resting, and it would improve by walking. And usually he takes some medication, but now it's not working, and this has impacted a lot his daily life. And along with that, there are no associated symptoms of any psoriatic rash or skin involvement or any abnormal bowel movement that could or involvement of any other system like eyes or aorta or any system, any signs of lung involvement. Along with that, there are no signs of any weight loss or any fever, which would point to some chronic conditions. That these are important negative
Oh,
findings in the history, and
oh,
on basis of these okay.
okay.
Should
So
I
what's your
also?
differential diagnosis in this
So
case?
first of all, the my foremost differential diagnosis is ankylosing spondylitis, and after that the enteropathic enteropathic sacroiliitis and Retter's sacroiliitis, Retter syndrome, and after that, along with that, any chronic, although there are no symptoms, but I would also like to look for any hematological condition like myeloma that may cause these symptoms because of either
Okay.
hypercalcemia or plasmacytoma, etc.
Okay. And how you will investigate this case?
So first of all, we will do the baseline investigation that are important, like CBC and ESR-CRP, which would be raised, and the complete blood picture may show anemia and raised uh, raised, WBC count could be there, and CRPSR could be raised. Along with that, we will look for the three important tests like RF factor, which would be negative, and NDCCP, which would be more likely negative because it is a seronegative arthritis, sacroiliitis. And the most important is HLA B27 and B7. These two tests,
Okay.
which are mostly positive in this condition. And along with that, first of all, we will go for the X-ray of the sacroiliac joint and spine to see any fusion or any changes, any fibrosis, or any syndesmophytes, etc., in the vertebral column.
Okay.
After that, if
And
we did, we may go for the higher scans.
okay. And how you will manage this case?
So first and foremost is patient education about the illness, that what the things can help him to improve his symptoms, which the most important is the activity. Like we will advise the patient to do exercises, and swimming most important. That is a very effective thing in controlling the symptoms, as well as physiotherapists will be involved. And after that, we will go for the NSAIDs, and along with that, we will go for TNF inhibitor, the biological demands, TNF inhibitor, adalimumab and rituximab, and
Okay.
two other noms I don't remember right now. Sorry for that.
Okay. Is there anything else? Okay.
Anything else? Like as I already described, that we will involve the physiotherapists and occupational therapists, so we will also take their help for this condition.
Okay. Thank you, doctor. Thank you so much. And thank you. This was a wonderful case from your side. And what do you think? Where is the difficulty in this case?
Difficulty in this case, I for the differentials, because I go for the all seronegative, and after that I just add on some others
A
as I
differential was
noticed.
okay.
Otherwise, there were
You
no
will,
symptoms
you
or any
differential
signs.
was okay. According to this marking criteria, you can get 4 by 4 in the
Case.
differential diagnosis. Not a big deal. And what about
Okay.
your
And
history?
as far as I think, I did I miss anything? I don't. I have tried my best that I ask involve anything, everything. But if I
Okay.
skip something, that only you can judge me, doctor. I can't.
Okay. Let's talk about your today progress. Okay, and your presentation. There are few jargons there. Okay, you have mentioned some ulcers. That must be a
Okay.
soreness. Okay.
Okay. Okay.
And
That I didn't know, and actually I want to know about this thing. That's why. Okay.
okay.
Ulcer soreness, mouth
Yes.
soreness, we will say. Okay.
Yes. Soreness. Okay. And there are repetition of a little bit information. You have asked 2 3 times. Don't need to repeat your questions. Once you have finished the question, you have to. You should be active listener. Okay.
Yes, I was listening actively, but just for the thing that maybe I have missed, or maybe I should ask it. I did it. I will be careful next time. I will, one thing that I have asked, I will not ask it again.
And
Okay.
you were sending the patient for smoking cessation clinic, not so smoking cessation clinic. You were sending the patient to the social worker.
Hello.
Okay, social worker.
I didn't know, the doctor.
That,
That's
yes,
a
a social
question
worker.
because, uh,
Okay.
we send them
Okay.
to smoking cessation clinic.
Yes, yes. We will discuss about it now and
Okay.
how to this approach. And one more thing,
Yes,
you
I didn't know that.
and so you have
Hello, I
mentioned that
can't hear you. I
you
can't
can
hear
listen me
you.
now. You can hear me now. My voice is clear.
Yes, yes, doctor.
Okay, doctor. The next more thing, most important
Hello,
thing. Can you hear me
hello.
now? Hello.
No.
Doctor, my voice is clear?
Hello. Now I can hear you. Please talk. Now
Okay.
it's clear.
Okay. One more thing. You have mentioned the condition ankylosing spondylitis. Okay, you can mention it. It's a medical jargon. You can explain in another way. Sorry for the medical terminology. Let me explain you in a simple words. Then you have explained very well. So it's a soreness or some swelling of your lining of the joint. That's very well. Okay. And concerns a little bit. You overlooked a few concerns there. Okay.
Like what?
When I ask is a curable condition, you should be very straightforward in this case. I highly appreciate your concern, Mr. John. This is not a curable condition, but it can be controlled simply. Okay.
Okay. Actually, this is my my question for any rheumatological disease, because they are not curable disease. So I want to know that how should we say that? We should say it's a
control. We can control it. It's not a curable,
not
but we can control it.
But we can control it.
Okay.
Actually.
Okay. Is anyone want to comment on this case? Either I'm going to discuss the approach of backache, how to approach this case in real exams. Is there any queries, any question from anyone? Okay, doctors. If there is no question, then I'm going to approach this case. If the patient start with the backache, young man. Hello. So I'm going to mute all. Let me explain. Let me discuss with you the how to approach a backache when you face a backache in the real exam, especially in the youngs. Then a few possibilities will be there in your mind. Just do OD para, and after OD para, go to the character of the pain, like Lokira or something like Socrates. Then the doctor took too much time here to defining the red flags. By me, it should be done in the immediately after the Lokira or Odipara or Socrates. So you should ask a few questions about the red flags like cough. It increases with the cough, sneezing, or bending forward. Ask about the bladder and the bowel function or any incontinence or and numbness and tingling and stiffy or floppy. Ask here when are you going to finish your Odipara. Red flags. Then come to the differential diagnosis. Establish first what kind of pain is it. It's a mechanical or inflammatory. So you ask a few questions about the traumatic. Do you have any recent trauma, or did you lift a heavy suitcase or whatever heavy physical work in the recent past? And this patient is most likely of 35 years old, so it's less likely mechanical. So inflammatory, he will giving the history of inflammation, stiffness, morning stiffness, nighttime he's awakening. So rule out the first these 4 diseases. Pair means stands for psoriatic arthritis, A for ankylosing spondylitis, I for IBD, and R for Ritter syndrome. The doctor did very well here. So she ruled out every case there. And after immediately this, just go to the local associated symptoms, which must be swelling, tenderness, any change of skin color, any crepitus there. Okay. Then go to associated general questions. What might be the associated general questions in this case? Once you have identified this case is a ankylosing spondylitis, starting from the head to toe. Eyes, ask about the redness in the eyes, soreness in the mouth. Come to the chest, any cough or shortness of breath, racing, pacing in the heart. Come down, tummy, you have any hard or loose stools. Come down, then ask about any burning micturition, burning in the urine, or any passing your urine more than usual. Okay, then rashes on the skin and the nails especially. So this is an associated general question related to this case. Once you have finished this, come to immediately impact on life. The doctor took a long time. She came to the, In 10th minute, she came to the impact of the symptoms. It's my humble request to all of you, when you are going to real exam, please fix your few things in mind. If you look at this mark sheet, clinical communications, look at the clinical communications, what they are asking from you. Appropriate comprehensive history relevant to the clinical presentation in a professional manner. Assess impact of symptoms and identifies patient preferred management options here. So they are so interested to know, to hear from you that how you are going to discuss the impact of this symptom on the patient's health or patient work. So immediately when you are going to finish this associated local and general symptoms, ask impact on life, then go to the general symptoms that we are already always discussing. General symptoms will cover almost every your systemic symptom. WAFers, W for weight changes, A for anorexia, F for fatigue, F for fever, lumps and bumps and night sweats, I for itching, R for rash, S for snoring, S for sleep disturbance, and S for sweating more than usual. Then come to the professional life. Patient is especially in this case, smoking history is very important, because smoking can worsen his ankylosing spondylitis. You have to stop smoking. Driving is very important. In the ankylosing spondylitis, patient must inform the DVLA. That must be a concern for the doctors also, because it's a safety. So safety netting is very important here. Then alcohol and the family history. Doctor was asking, do you have any family condition? No. Ask about if you have similar family condition, similar illness in your family, because patient is having ankylosing spondylitis. Your question must be focused over here. Similar condition in your family. Okay. Then come to the rest of the questions. Surgical, past medical history, and tuberculosis. Tuberculosis question was very important here to rule out the infective cause. Then coming to the examination. So examination, when you're facing patient with ankylosing spondylitis in exams, start introduction, then ask the patient to stand up. Start your examination from the standing position. Don't start from the lying position, because too many maneuvers you have to perform while patient is standing. Ask the examiner, I want to expose the patient, take permission, remove the shirt, take a look from the back and from the sides and from the front. From the back, you will see thoracic kyphosis, lumbar lordosis. From the side, you will see hyperextended neck, like a sign of exclamation. And from the front, just check distended abdomen. Check the range of movements from head to toe, from the neck, then arms, then come to the spine, lower spine. Lateral flexion, extension, check the range of movement, wall to occiput ratio, then modified Schober test or Schober test, but you will not perform it. Always, when there is a time-consuming step in the examination, always involve the examiner. Sir, I want to do the Schober test. Most of the time, examiner will ask you, tell you, no need, there is a negative or positive. That makes sense. Is there any question till now? Next, ask the patient to lie down. While lying patient, start from the hand like this, doctor. Check the nails. Check the collapsing pulse. I was stressing on this. Why you want to see the pulse? She was good volume pulse, but it's a medical terminology, collapsing pulse. Check the collapsing pulse. Then go up. Check eyes, redness, and offer fundoscopy. Here. Auscultate the chest for apical fibrosis, lungs for the murmurs, tummy for any mass or any swelling, and check the plantar fasciitis. You can ask the patient while patient was standing there, take a few steps, do you feel any pain? Just ask. Either you can just put make a gentle pressure on the feet, plantar surface, and ask, is there any pain or not? Do a motor, a sensory, both examination. Sensory examination was missing in this case by the doctor, but you have to perform the motor and sensory examination, and your examination will be finished. So this approach from start to the end, especially when you are facing a case of any backache in the young, psoriatic arthritis, ankylosing spondylitis, or some IBDs or reactive arthritis. Coming to the investigations now, investigation was fine. So baseline investigation, the specific investigations, or specific X-ray must be at the top. If inconclusive, we will go for the MRI. We will look for the edema. Then X-ray, MRI, actually B27, 90% in 90% of the cases present. So RA factor, anti-CCP to rule out the other diseases, and also urine and stool cultures to rule out the other causes of this seronegative arthritis. And coming to and then management plan, again, two types, non-pharmacological and pharmacological. Non-pharmacological treatment, again, patient education, counseling, multidisciplinary approach, stop smoking, exercise, physiotherapy, social health worker, occupational health worker involvement, orthopedic measures, rheumatology, and good nursing. Regarding the specific treatment, we will not give you any specific management. This is symptomatic management and sit at the top. If the patient is not improving, and we can go for the DMARDs first, not anti-TNF. DMARDs first if the patient is having peripheral disease. If disease is still persisting, we will go the anti-TNF. Then there are specific conditions. We can give oral steroids like in the uveitis, local steroid injections for plantar fasciitis, and surgical involvement if the patient is having a spinal deformity. So this was the whole approach and the whole discussion of this case. How can we present this case in exams? If anyone having any questions regarding this case or anything regarding the approach or clinical findings, you can ask.
Doctor, I want to ask myself.
Yes, please.
First of all, I didn't know where to refer patient for smoking. That's why I used it. That was my question as well, as I have no one to guide me how to use words and what to do. That was the mistake. Because of that, I didn't know where to refer the patient. Okay, and second is how to ask about TB. Like I said, that is there any chronic cough or any fever? So those were in the background of multiple myeloma and TB, like chronic condition. Should we
Yes,
ask directly about TB?
You must ask directly about the TB and contact with the tuberculosis.
Okay.
Did you have ever tuberculosis in the past or any contact with the patient with the tuberculosis? You can ask directly, especially in our countries, Pakistan, India, Bangladesh.
Yes, that's the thing. Because
yes.
Okay. Because of the background, I did skip it that in the patient. But okay, if we are here, then we will ask. Second, what to do the complete motor system in the lower limb, only powers. What should we do in the check examination?
Doctor, look. I will if I will do something. I'm just giving you some ideas about their, answer sheet. Okay. They are asking from you a focused examination. Just check the motor. Ask him to raise his legs. If he is raising both his legs, is that enough? Motor is enough.
Yes.
Just take planters and sensation. Just make a pin prick or just superficial touch sensations. If these things are okay enough, because it's not a neurological case, you want why you are going to check these things, because you want to rule out the red flags.
Involvement, reflexes and spinal involvement, nerves involvement. Okay. I skipped the sensory part because I didn't know what to check or complete. So, but next time I will keep it in mind and will make it in my scheme. And also about the impact according to the history, asking like the uh, in the history scheme of my history scheme, the impact comes in last. But as you said that if it's a scenario to ask the impact, then we should add it in the beginning, just after the symptoms.
Doctor, what we have done
I
in real exams, I will give you an example, and it's very helpful. I will not ask you to do same, but it is very helpful. Just try and practice it. Go with the introduction. After immediately introduction, give sympathy and empathy. This must be a difficult time for you. I will try my best to sort it out and help you accordingly. After giving the sympathy and empathy, just ask him few questions here. Do you have any diagnosed medical condition which I should be aware of? Take medical history, past medical history here, and ask here. Are you taking currently any medicine, drug history here? Because
in the
why?
beginning.
In the
In the
beginning, why?
beginning. Okay.
Yes, I will explain you why. Because in clinical consultations, in PACES exam, mostly they are bringing the rheumatological cases or endocrine. So they are very interested. They are correlating with the drug side effects, impact, you know. So take this history at the top, go and do the ODPARA. ODPARA, last A for association, local association, the general association symptoms. Immediately take impact of these all symptoms which you have taken, discuss with the patient, impact on life. Okay. Look at the answer sheet. Look at the clinical communication skills. Look at the second part, assessment of impact of the symptoms and define patient preferred, identifies the patient preferred management options. So they are asking from you, you have hidden marks over here. Don't delay it. Don't waste your time.
Okay.
Just check your impact over here. Take your marks in your pocket.
Okay.
Do you understand why I'm asking, why I'm stressing, why we did in our practice? Because wherever you have a marks, because we are following the schemes, they have a set criteria. Just follow this criteria. Whatever the history you are taking, you are going to take only 4 marks. Your other 24 marks are in front of you. So try to grab them also. Do a bit everything. You did very well regarding the investigation management plan. Differential diagnosis, you will get 100% marks. Investigation, you will get maximum marks. Patient concerns, there are few things in the patient concerns. Otherwise, you can get easily 3/4 or 2/4. And patient welfare were very good. So look, where you are going to lose your marks in this case, in communication skills.
Okay,
if you
tell me that.
Yes, why? The suicidality, this smoking, alcohol, jobbing, and impact on the job, driving, and tuberculosis. You asked me in the 10th minute of 10th minute of your history, which shouldn't be. Yes. This should be on the 4th or 5th minute, and you should finish your history in 8 minutes and ask. And what did you wrong? One thing more. Let me discuss with you, because it's of your first case. So you will learn a lot today. After taking the history, go for examination rather than to explain the condition.
Okay, that's the thing.
History, examination, then explaining the condition, then facing to the examiner. So this is the sequence.
And when should we ask about the concerns? Before examination or after that?
After examination, this is the
after
opening.
Examination.
Yes. This is the point where you open up with the patient directly face to face. So what's your concern, Mr. John? Doctor, what's going on with me? Based on your history and examination, I suspect you have a condition that, but I will keep another thing also which having a similar manifestation. Okay. So you're now give a plan to him. What we are going to do next, we will do some blood test and also scans of your body. Once the result will be available, we will sit together. And make a management plan with you. You will not impose your management plan and him. I will give you this one, and this. No, you will discuss with him what we will do with you according to your preference. So you will fulfill this block here, and the examiner will be happy that you are taking the patient on the board, or you are going together to make a management plan.
Okay.
Okay.
Okay. And one thing that you told many things like patient education, counseling. I
Mhm.
missed some things: smoking cessation, rheumatological involvement,
But
orthopedic involvement, and
yes,
what else? These are so many things that I couldn't even remember them right now.
uh,
You told
I
so
will
many
try my
things.
best. I will try my
Hmm.
best to make a scheme chart. Okay,
Hmm.
and how to operate this case, total approach and management plan in a one page.
Hmm.
So I will share in group. But by God, being a first case, having a first case in your life, you did very great job. Okay, you have covered a lot of things. There are few things need to modify, otherwise you know everything. So
Yeah.
you will improve
Okay, and
yourself
it's
by doing a lot
always
of things.
important that we should set that pharmacological, not pharmacological, and basic investigation and specific investigation. We should always go like for that.
Doctors, listen to me
Hmm.
now carefully. What I'm going to tell you, what we did in
Hmm.
our exams,
Hmm.
we didn't even give any information.
Hmm.
Examiner is asking how you will investigate this case. Sir, I would like to do the investigation to confirm my diagnosis. I
Hmm.
will investigate to look for the complications. I will investigate for the severity of the disease. He didn't even ask
Okay.
another question. What you will do or
Okay.
not? He was not interested to listen. You give a just management, main
Okay.
things. You
Hmm.
should give an idea to the examiner that you know something, what you're going to look for.
Hmm. Hmm. Okay. Right, doctor.
So